Invisible conditions or invisible disabilities is essentially a medical condition that is not apparent to others. You can't see it by looking at the person. It's hidden within your body or within your mind. Some examples of common invisible conditions include mental health claims such as depression, anxiety, post-traumatic stress disorder. They also include chronic pain conditions such as fibromyalgia, chronic fatigue syndrome. All of these types of things may not be apparent when you're looking at a person, but that does not mean that they're not challenging and disabling. So invisible condition claims are often denied because of a lack of objective evidence. We talked about objective evidence in another video, but objective evidence generally means that you have a test or a result that shows that you have XYZ medical condition. Because invisible conditions are not visible, they're often difficult to prove and are only based on subjective complaints that you report to your doctor, such as, oh, I'm feeling like I have no energy. Oh, I feel like I can't concentrate. Those are sometimes symptoms of a mental health condition, but they are subjective and based on what you're telling your doctor. Insurance companies often don't believe these types of subjective conditions. They have a bias against them and they don't understand these types of complaints and how they can prevent a person from being able to do their job. I would say it is often common to have incomplete or vague documentation when you have an invisible condition because you're just focusing on how you're feeling and the doctor doesn't always know exactly how you're feeling every day and how that leads to an objective diagnosis of a certain medical condition. So they might leave information out that is actually quite important. So to document invisible conditions, oftentimes clients are told to write a log of how they're feeling on a day-to-day basis. Today I had a good day, today I had a bad day, and this is what I was feeling, this is what I was able to do or not do. And some doctors will ask for that information, and if you have a record of it, you can say, look, out of a week, I only had one good day. And this is what that meant for me. And then a doctor will be better able to say, look, this person is only functioning one day out of 7, and there's a percentage that you can tie to that. And that becomes more quantitative and something that insurance companies will be more likely to listen to.